your thoughts with us.
Thank you, madam, for your nice introduction. Just now, Professor Govindred has come. I think he has joined. Hello.
Hello.
Professor Govindred sir has joined.
I am here, sir. You
Yes,
speak,
sir.
Janardhan Reddy, sir, you speak, sir.
Okay, I will wait. Because madam requested you to extend a welcome to other people. Okay. Let me thank our friend and also our Professor Govind Reddy. He is a president of this World Congress for Psychologists, and I'm happy for giving this opportunity to associate with this an excellent program. That is a counseling 3 months program meant for counselors. It is an important one that he has planned and designed this program. It is an important one. It is to be done. This counseling, so all of you know, I did not say anything. The importance of counseling now, especially in schools. So not only in schools, in different areas, counseling, the need for counseling is on the rise. It is increasing because mental health issues are also increasing, and the demand for mental health professionals is also increasing. You know that National Mental Health Survey, which was conducted by the NIMHANS at the request of the Government of India, it made a national mental health survey. In that survey, it clearly pointed out that survey. One important point that was highlighted, that is there is a huge treatment gap between the demand for mental health services and the availability of mental health professionals. There is huge demand for services, but the availability of mental health professionals is very low. The availability either counselors or psychologists or whatever it is. The professionals available in this area are very low. That means treatment gap is very high. It suits the need for training different people to bring them to the or to provide counseling services to various categories of people. It is an excellent idea that Govind Reddy has formulated one program, at least to fill the gap to some extent, because it is national mental health gap. Of course, we will be meeting this gap requirement in a smaller level. Okay. The other thing is various problems. The school students, when we talk about the school counseling, various problems that students are facing, teachers are facing, and parents of the children are facing. The many these psychological disorders or behavioral disorders. This is causing a lot of problems both to the school teachers and also the parents and the students themselves because of these mental health issues. Their academic performance is very low. Many studies have been conducted about the impact of this mental issues and the academic performance. Almost all the studies, they have clearly showed there is a strong impact on the academic performance. That is presence of this mental health issues or various disorders. One disorder that is growing now drastically is internet disorder, or the internet addiction disorder, or screen dependent disorder. It is growing, especially among the school students and the adolescents, mainly adolescents. It is growing that parents are feeling the problems, and also management of schools are also they're experiencing the problems exhibited by this type of children. Recently made me knowing there is one clear example. This that happened in Lucknow. One adolescent is there of 15 years age. He is addicted to the internet. especially mobile addiction was there. And his mother prevented him from using the mobile for this internet games. So when he was repeatedly prevented, he was prevented from doing it. So finally, what happened? You might be knowing. Finally, what happened? Mother consistently not allowing, preventing him from using the mobile or any internet. So it has gone to the drastic, extreme level. It has gone to the extreme level of murdering the mother. He has come to that level. That means what you have to understand here is this type of disorders, screen dependency disorders, that is SDT, the SDD. These type of disorders are causing a lot of problems to the children and also the parents. And violent behavior is also increasing. Many studies have also established the relationship between this internet addiction or mobile addiction and the aggressive behavior or violent behavior. Higher the usage of net or the mobile, the higher the level of aggression or higher the level of violent behavior. Such studies are plenty. That means this type of thing has to be reduced. It has to be prevented. So in this line, the school psychologists have a greater role to play to educate them, to counsel them, in order to prevent them or treat them by giving the treatment. We can help them from using. They can avoid this type of violent behaviors. First thing is reduction of this addiction. And as school counselors or any counselors, you need to equip it with ourselves. Several counseling skills and experts like Dr. Krishnamurthy and Vedagiri Nageswar and various other experts might have provided a lot of information, or the skills also might have been taught to the participants. So as a school success, one or 2 points I want to say, then I will stop. So to become a successful counselor, either a school counselor or any other counselor, what is that you want? So various skills you need to acquire during this process of training or otherwise. So they must have some specific skills. So for example, say attending skills, then the listening skills and reflecting, and the like that the confrontation is there, and how to respond. And the most important thing that a counselor should have is how to establish rapport. Rapport building is an important one for a counselor, that you must learn it. Another important thing is this famous psychologist, counseling psychologist, Carl Rogers. He is a Nobel laureate also. He said 2 or 3 important factors for a successful counseling. According to him, is one thing is extension of unconditional regard. This counselor is expected to provide unconditional regard to the clients. That is an important condition, as according to Carl Rogers, in counseling. We want to become a successful counselor, you must follow that principle, that is providing unconditional regard to the clients. And another important thing that he has cited is empathy. Empathy is important condition and necessary condition for a counselor to practice. Like that, many other skills also there. You must develop those skills, then you can become a successful counselor. You must also have an understanding of certain counseling issues are there. We teach academically, but they are also useful for the practicing persons or the counselors. From academic point of view, there are special counseling issues or problems are there. Then is one is interfere the transference and counter transference. Transfer is an issue or a problem, and counter transference is another problem that is related to the counselor, and transference is related to the client. And another important issue that has to be understood is resistance. Resistance. The clients they will be resist. They resist the counseling process. They will not be cooperative. There will be several problems they will be facing. So that means resistance is an important issue or a problem, and the transference and counter transference. These are the important issues that the counselors should have an understanding of these issues, so that they can avoid, they can easily get over these problems when they become the counselors. With this, I conclude. I thank our friend Professor Govind Reddy for giving an opportunity to associate with this excellent program. Thank you. Wish you all good luck. And I also happy that Krishnamurthy is today's resource person. He is a good academician and also counseling psychologist also. He is an excellent person. I am happy he is today's resource person. I thank you all.
Thank you very much, sir, for sharing your thoughts about the status of mental health today and the need of counseling in schools and colleges, and also telling about the characteristics of counselors, and the importance of understanding of the issues related to counseling. Thank you very much, sir. Now, I request our resource person, Professor A.R. Krishnamurthy, to take over the session. He needs no introduction because he is a familiar personality to us. As a clinical psychological consultant and physiotherapist, I request you, sir, now to share your thoughts today to the group.
Thank you, ma'am. Thank you, Professor Jonathan Reddy. Thank you, Professor Govind Reddy and other dignitaries. It's a pleasure to be here on this platform to share my views, my experiences in this regard. So ours was the first batch in Mysore University to have training in clinical psychology. Then I also had training in counseling psychology at Bangalore University and also training at NIMHANS. So I started working on farmers' motivational levels and risk-taking behavior. Then I started teaching. I also worked on cognitive hierarchy in cognitive learning. After that, I joined teaching. I started 33 years at Tiptur College and then moved on to Coimbatore University after my retirement. We started the Department of Clinical Psychology. I was there for 8 years to chair the department. So in that, we had a lot of training programs for the students, exposure to the clinical setup, and also made them to practice certain techniques. Apart from that, Manasa Educational Foundation also started a program on counseling and psychotherapy under Coimbatore University. So it was successfully run till 2015. Later on, we have shifted it to Bharatiya Vidya Bhavan's Association. Still, we are running a PhD diploma in counseling courses. So with this background, I'm happy to share some of the ideas that I have acquired. So all of you, as you are all a participant here and have been exposed to counseling sessions, counseling training, and so on, I won't like to repeat on what is counseling. Yet, the main point I would like to emphasize is on helping process. Many mistake it as guidance, advice, and so on. It is not giving advice, it is not giving guidance, it is not giving judgment, and so on. it is a helping process. So through this helping process, what we do is we develop new skills to increase understanding of the counseling and also other situations about the others as well as the situations that they are going through. So this counseling works with the clients and childhood as well as adolescents, adult, and extends itself to old age. Professor Janardhan Reddy already pointed out many areas that are very essential today. So what are the skills that is required according to Carl Rogers, the unconditional regard and then empathy and then so on. So it is what we see as a focus on developmental, environmental, and cultural perspective. It is a lifespan work. So to just mention about the types that we have that we are going through, it is we have mental health counseling, career counseling, rehabilitation counseling, and relationship counseling. It may be with marriage, with regard to parental and childhood problems and so on, relationship counseling, or in situation. In the rehabilitation counseling, we have a number of areas. The people who have undergone trauma, who are to undergo treatment, or who have been subjected to injuries and so on, they have to be rehabilitated. In that, we use counseling. You might have been very familiar with psycho-oncology counseling also, where we have a training program at Bangalore. Mental health counseling is the dominant one. Now, I am going to focus more on counseling process and also the need for counseling at the high school level. So what is this process? When we say counseling process, it means a planned, structured dialogue between counselor and counselee. So we plan out. It is not a haphazard thing that we take up. And also structure it under different steps. And we carry on conversation, dialogue between ourselves as well as the counseling. And as Professor Janardhan Reddy emphasized, it is a cooperative process. It is wherein the counselee has to cooperate with the counselor. So here we have trained personnel, that is professional, whom we call as counselor, who helps a person, that is counselee. The main purpose is to identify sources of difficulties the client is experiencing. That is the foremost thing. So identifying or the sources. Then develop ways to deal with the problems and overcome them. So there are mainly two areas. One is identifying the problem, sources of problem, and then helping the counselee to develop ways of dealing the problems. So we can describe counseling process as both an art and a science, helping to bring about changes in thought, emotion, and behavior in the counseling. So we have the theoretical part, the collected data and so on, which we call as science. And when we put it into practice, it becomes an art, the personal skill that we make use of. So what does this extend to? It extends to bring about changes. So it is more about changing the behavior, changing the emotional pattern, changing the thought process. They are all interconnected. So if you have seen the cognitive approach, thoughts leads to emotions and behavior, distortions in behavior, distorted thought. So when we, as I pointed out, when we use the term counseling process, it represents progressive movement toward resolving the problem and maladjustment. So step by step, we go there to achieve the outcome, that is correcting the maladjustment. So it adopts a series of steps for the counselor and client to move. What are these steps? One is relationship building. Then second is problem assessment. The third step is goal setting. The fourth step is intervention, counseling intervention, putting it into action. Then finally, termination, evaluation and termination. Now let us move one by one. So the central idea in counseling process is relationship building, problem assessment, and goal setting, followed by adopting intervention strategies and achieving harmony. So first part is to build up a rapport, what we generally call it as the relationship building, then assessing the problem. So collecting all the information, relevant information, making a formulation, case formulation, and so on, we call it as problem assessment. And finally, we also set the goal that we have to achieve. This is followed by, as I told you, intervention strategies and achieving intervention strategies. So a very important point is that both counselor and client must be aware that the counseling process requires a lot of patience. We have to, we cannot hurry through or rush through these processes. It requires a lot of patience because counseling process rarely has a quick fix. So when something breaks away, we put adhesive and then bring it together. We call it fixing up. So it is not a quick fix that we make use of in the counseling process. So it follows a series of collaborative steps, cooperative, that is coming together in this process. So as I listed out in the beginning, it is what we call as relationship building or rapport establishment. So what we do generally, as you have been trained in this process, we introduce ourselves, then we try to get the client or the counselor to speak, so to share his background. So it is the initial interview that we carry on. In this initial interview, we engage the client to explore the problems that affect the counselee. So after knowing who the case is,
Sir, please unmute yourself, sir. We are not able to hear your voice.
okay, automatically it is getting muted.
Yeah, yes, sir.
So when the counselor, he starts his session, it is initial interview. He collects relevant information about the client. So age, gender, and background and all that. So with this initial interview, he proceeds to exploring the problem. What problem the individual has, the child has, or the counselee has. For example, I was referred with, I attended usually both the therapy sessions as well as the counseling sessions in my training programs that we conducted. So in that, we usually used to get hold of the individual who was referred to us and collect all the relevant information and make a case formulation. So in that, we used to collect about who the person is, what his background is, his education, his occupation, if he is employed, or if the child, if it is the child, then about the age, where he is studying and all that. Later on, the focus is on what we call as exploring the problems. What problems the child or the individual has. So here we have to use a lot of good listening skills and build a positive relationship. So when the person is trying to open up, if we start questioning, then they may inhibit. Otherwise, we can ask with open-ended questions if the child or the individual is somewhat inhibitive in his approach. So this is what we have to do. Develop positive relationship here. and also confidentiality. This is going to ensure a strong foundation for the future dialogue. Unless we succeed in breaking the ice with the client, it is not going to work. The sessions will not work. So as Professor Janardhan Reddy was telling, they may resist, they may absent, they may not come, turn up. This is what we see also. Or they come and sit silent without speaking anything. So these are the things that we come across, what we call as initial resistance. So we had to break this initial resistance by creating confidentiality. Then only the future dialogue will continue and they succeed in counseling process. Now, from establishing relationship, we move on to what we call as problem assessment. How do we go with problem assessment? Relevant information will have to be collected here. Sometimes case history techniques is going to help us from childhood. If the person is an adult, from the childhood, we can collect information. Then also about the problem that he is going through. So this is what we call as a problem assessment. So it is beneficial with collaborative relationship. If the client collaborates with the counselor, then it is going to be successful. So here, counselor carefully listens and draws out information regarding the client's situation. For example, home, education, work, school, and whatever it is. The reason is the reason for which they are seeking help. So this information is very crucial to subsequent stages of counseling, which includes identifying the triggers, what triggers, say for example, the individual is with anxiety. What triggers this anxiety? Let us say the person is a student who has examination phobia, fear. So what triggers him to develop this problem? So we have to identify the triggers and the timing and the environmental factors, stress levels, and other contributing factors. So I'm not going to elaborate all these things because many of you have been exposed to these information. I'm running through some of the important aspects. Then comes up the action part, goal setting. So this counseling, which has to be effective, depends on setting appropriate and realistic goals. So building on the previous stages. So we have earlier the condition of establishing rapport, confidentiality, and then getting all relevant information, which we call as case formulation. So once we have these information, we are going to formulate the case. What is required to help the individual, the client? So based on the previous stages, we set appropriate and realistic goals. Unless the goals are realistic, we will not be successful. So it has to be identified and developed collaboratively. We have to see that the client also participates in this event or in this process. We cannot define what is to be done to the client. So the client also will have to identify and develop the goal. So because the client commitment is very necessary here to set of steps leading to the whatever outcome that we have. Then comes up the fourth stage, what we call a step called as counseling intervention. So we have, once we have formulated the case formulation, we can decide what course of activity has to be brought in. Say, for instance, changing the thought process or attending to the emotional distortions or behavior. We have got various approaches here. Some of them may be behavioral approach. Some of them may be based on a learning process. Some of them may be cognitive approach. Some of them may be on psychoanalytic basis. or on humanistic approach, whatever it is. So we have got person-centered approach, what Carl Rogers has developed, and we have got Bandura's and others approaches. So whatever approach that is necessary, we will have to make use of it to be brought into the action. Then comes up the stage of termination. Once we have the number of sessions that we have slated already in the plan, how many sessions we require with the initial interview and continue to the gathering of the data. Finally, we will also have to think of how termination also, assessment and termination. So termination may not seem like a stage, evaluation and termination. But the art of ending the counseling is very critical. Once we have attained the target, once we are sure that the person client is confident in making use of the techniques that we have that he has developed, so we have to end these sessions. So drawing counseling to a close must be planned well in advance. So already you have been exposed to various techniques. It is one way we have got psychoanalytic approach, we have got our dynamic approach, psychodynamic approach, behavior approach, cognitive approach, and humanistic approach. I'm not going to elaborate on them. But platforms or the formats on which we do counseling is, one is individual counseling. So face-to-face, one-to-one counseling is generally employed. Sometimes we may employ group counseling too. Nowadays, we have introduction of the telephonic counseling and online counseling. These are the formats that have come up. Now, I am coming to another part of my talk, that is importance of counseling in high schools. Why high school counseling has become very important. Already Professor Janardhan Reddy pointed out how in today's scene, there is a lot of dependency on internet and mobile. Apart from this, about 50 years back, when I conducted a survey on high school students using Mooney's problem checklist, wherein there are 13 areas, I found health and physical development, finance and living condition, interpersonal relationship, academic environment. Then as they are transforming from childhood to adolescence, particularly with physical maturation, they have a lot of hesitations, shyness and all that. So educate them with regard to the gender role and the stress and harm that they go through, it becomes very difficult. So young boys and girls are large segment of this population. They require a lot of assistance. So it makes a strategic sense to target them through guidance and counseling. So counseling is important at this stage. The reason is in this stage, as I pointed out, both boys and girls develop positive attitude. Whatever they have learned at the childhood level becomes insufficient or limited. Now they have to go with positive attitude at this level. So gender roles. During this stage, and who they are, what they have to do in the later stages, can contribute to healthy relationship. So personal and social conflict at this level can help in awakening students to educational and vocational opportunities, not only even to personal adjustments. So it empowers this group, that is boys and girls, to develop positive attitude towards themselves. This also adds an ability to acknowledge areas of expertise and to be free to make positive choices. Later on, they have to decide about the career after high school, what they have to go, the training, learning, and so on, education, and then career choices that they have. Then we also see two important areas apart from education, the family adjustment. marital adjustment and so on. So this becomes a platform for them to develop these things. So with this, I am concluding my talk. I have made a very brief presentation because already you have been exposed to many of these information. I just wanted to share a few important points here and share with it with you. So I thank Professor Govind Reddy for giving me this opportunity, and we are talking about my merits by Professor Janardhan Reddy and Dr. Shini Simon. Thank you very much.
Simon?
Sir.
Yes,
Yes.
madam, my talk is over.
Yeah. Thank you very much, sir. We had a lot of information regarding the process of counseling and the steps to follow. To just briefly to revise some of the points. In fact, I have learned the new thoughts about the steps to follow in the process of counseling, where you have given 5 steps, that is relationship building, that is building rapport with the clients in order to develop positive relationships and to understand their problems and causes of problems well, and to create confidentiality clients. Then the second one is problem assessment, where we can take some techniques like case history in order to collect required information about the client's problems. And the third one is goal setting, where we have to take care in setting the realistic and appropriate goals that we have to reach. As to mention, techniques to bring the desired behavioral change. And finally, the evaluation or termination of the process, where care must be taken so that it should be well planned as to where to conclude the session. Thank you very much, sir. I am really enriched with this. And I request now the participants to give your feedback.
Clarifications. Hello, participants can clarify seek any clarifications or questions. I think participants have clearly understood the lecture given by
There must be two. Excuse me, sir. There must be two things. One is I have not given proper information, or the other thing is, as you pointed out, participants might have understood whatever necessary.
Yeah, that's what I am telling. Participants are now just by coming to 17th session, I think they developed a lot of skills, proficiency on what is counseling, on the process of counseling, characteristics of counselors, and so on. So I think I'm really happy that our participants have just progressed as far as school counseling is concerned. I'm really happy, and at the same tempo, at least another 17 means another 6 to 7 programs are there. So our only objective goal, these participants should be enriched with counseling skills, and they should do the counseling process in a scientific manner. That is our main objective. So anyway,
developing professionalism.
Yeah, I wish you all luck to the participants. So that's what good night to everybody.
Sir, I would like to give a small feedback, sir.
Yes, please go ahead, madam.
So, good evening to all. Sir, I'm Shahina, sir. Thank you so much, Janardhan Reddy, sir, and Krishnamurthy, sir, both, for explaining us the importance of counseling in high schools. Sir, really very useful. Thank you so much for your intervention strategies, especially. Thank you, BJ Reddy, sir, for conducting us such informative sessions. Really, we are very much thankful to you, sir. Thanks a lot. Thank you, sir.
Thank you later, Professor Vijay Reddy. Now you just, we are very much worried about the sessions only. Any more participants to we just to say something? All are happy. Okay, then. Okay, you can say good night. See you on next session. Good night.
Thank you very much, sir.